what do you, if you could wave a magic wand, what would you change about your current situation? And the wonderful thing about nursing is there is so much. You could find it, whatever your passion is. If you want to start your own business, if you're wanting to be much more on the clinical side, if you want to be in the school setting, if you want to be, I mean, if you want to be, the most fabulous med spa owner on the planet, there are so many avenues that I just don't think there's any reason to get out of nursing altogether. It's more about sitting back. How can I utilize all this knowledge that I've gained over all these years? How can I tap into that while at the same time, what was working for me maybe 10 years ago is just not where I am anymore. That's the case, and we need to figure out how do we make that pivot.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to another episode. I am Dr. Tiffany C. Brown, your host. Are you a nurse and getting burned out in your nursing career and interested in a change? If so, then this is the episode for you. Today, I have titled this episode, From Burnout to Brilliance, Navigating Career Transitions in Nursing, where me and my guests will be discussing what to do next when you reach the burnout point in your nursing career. Now, let me tell you a bit more about my guest. Her name is Dr. Dayna Vidal, also known as Dr. Day. She is a nationally recognized healthcare executive and thought leader in clinical quality, patient safety, and nursing professional development. She currently serves as a patient safety officer at Wilson Medical Center at Duke LifePoint Hospital, leading system-wide initiatives in quality improvement, regulatory compliance, and organizational safety. With over a decade of leadership experience, much of it dedicated to advancing nursing education, nursing practice, and workforce development, Dr. Vidal has shaped the careers of countless healthcare professionals through innovative residency models, simulation-based learning, and evidence-based frameworks. Her deep expertise in professional development informs her work as a career coach and author of Find Your Fit, a guide for navigating purposeful careers in healthcare. Dr. Vidal has mentored and coached hundreds of experienced and new grad nurses through successful careers. Triple board certified, Dr. Vidal is a sought-out after speaker on high reliability systems, health equity, and leadership. She brings a strategic, people-centered approach to transforming care delivery through education, mentorship, and advocacy. So welcome, Dr. Day. I am so glad to have you as a guest today.
I am so happy to be here, Tiffany. It is a pleasure. This is a long time coming. I swear, I feel like something monumental. We're getting ready to share something monumental and transformative with somebody. I don't know who it's meant to reach today, but it's happening because the bad spirits out there was trying to stop this from happening for a minute, but we got it going.
Well, we rebuke those technical difficulties.
That's
not today.
right.
Okay, not today. So let's go ahead and get right into it. Those who have been following me and listening for a while know that I like to start my interview process by asking my guests to tell us about your genesis, your beginning. So, Dr. Day, can you share a bit about your nursing journey and what inspired you to pursue your doctorate and become a nurse leader?
All started with there's this encyclopedia that my mother used to keep in the bookshelf in our house, and I'm going back there because it is so profound when I think back on it. I think I was like maybe 7 or 8, and I would look in that little book so often. I would sneak. Y'all know the old china cabinets, how they used to be. You couldn't make a move. It was rattling. It would be moving. The little glasses in there would be shaking. I couldn't even get away with it. My mother would be like, "Dang it, put that book that." She didn't have to come and look and see. So I've always been mesmerized and fascinated with how the body works. this balance and this inner kind of duality that we have within our bodies. And it was always very interesting to me. But we had an ad agency, it was our family business. And so sometimes, you go the path that's kind of expected of you before you find your own voice. And so sometimes you kind of just go along with it. The company was named after me and my sister before we even had a choice in the matter. And so I ended up in business and advertising at the very beginning. I went to Florida A&M
Mm.
University, go Rattlers. And I was in the School of Business and Industry and got my business degree with a concentration in sales and marketing. What reawakened it for me, my final semester, I had an internship with Pfizer Pharmaceutical and back to the body because of course it was a true sales internship. We had the company card, the credit card, all of the things. Went up to New Jersey, went through all the training that they do in Palisades at that time, for Pfizer, and I learned about all these different things about how the body works. I sold Norvasc, which was amlodipine. At that time, it was brand new, taking the place of Cardizem CD, and we had to learn how the whole cardiovascular system. And we were selling Zithromax, azithromycin. At that time, it was brand new, it was the Z Pack, and learned how the integumentary system. And at that time, I didn't know what was what from that. And listen, I was the most training that I had in terms of anatomy and physiology was creeping and reading that book in the china cabinet. It was fascinating to me to be back in that space. I called on physicians and a lot of nurse practitioners and a lot of OBGYN providers. And I was afforded the opportunity to be invited to go and see hysterectomies and surgical procedures, C-sections, all sorts of things, just as a part of me calling on some of these providers. And again, it reawakened that calling in me. But again, I resisted it. And I was like, oh my gosh, I am 22 years old. It's too late to start over now. That young thinking. It was the last thing I had to do to graduate. And so I didn't want to start over. And so I was like, oh, well, too late. I'm 22 and I'm about to graduate with this business degree. So I did the expected thing and I went and worked in the family business. But fast forward a few years, I really, it was still there. Wanted to do something meaningful. I wanted to do something where I felt like every day I was making a difference. And it was fun. I was doing post game concerts and doing all sorts of things, hanging out with players from flying on company planes with the team plane with the Atlanta Hawks. It was a blast for a 20-something-year-old. In the 90s and So Def, I don't know if anybody knows that in Atlanta, it was when the whole music scene was really popping off in Atlanta. So there was a lot to do. I learned a lot, but I didn't know it then, but I was being honed for something else. But I did. I wanted to make a difference, and my grandmother got really really sick right around the time where we had all decided as a family that we were going to stop with the business because marketing and advertising had changed quite a bit getting into the digital space. And so I said, I'm going to go back and do something in healthcare. Don't know what it is. I had no idea what I wanted to do. But at that time, my grandmother got really ill and was hospitalized with a pressure injury. We didn't. There was no one in our family who had any clinical training. We had no idea what was going on. But with my nursing knowledge now, I know that she had gotten septic from this pressure injury that she had received. Um, Went into the hospital and she spent a lot of time in the ICU. And it was there that because of her being septic, she didn't know all those toxins were running through her body. She didn't know who we were. And I might be a little biased in saying this, but I feel like I was her favorite grandchild out of all the many grandchildren she had. I'm 100% certain I was her favorite, but she didn't even recognize me. And it was devastating. It really I didn't understand it. I knew it wasn't her fault. But what was interesting, one day I was sitting in there talking with her and her nurse walked into the room. And her nurse says, and when she walked into the room, my grandmother looked up at her and she just, this recognition comes over her face. She asked her, she said, are you going to be my nurse today? And she was like, yes, ma'am, I'm your nurse tonight. And the look on my grandmother's face, the sense of relief, that recognition, she was so happy for this nurse to be taking care of her. And from that moment, I said I wanted to work in the ICU. I knew I wanted to be a nurse. And it was almost as if my grandmother was still giving me that wisdom and that guidance, and she didn't even know it. She did not make it out of that hospital visit. She went into kidney failure and did not make it out, but it stuck with me so much that if there's a time, it gave me a sense of relief too, as her granddaughter, to know how she felt about this nurse that was taking care of her. And it just stayed with me. And it's what I drew from once I got to the bedside. So I went back to school. I got my prereqs, Atlanta Metropolitan College right here in Southwest Atlanta. Got my prereqs, went back to school. At this point now see if my path could have been when I was hearing the calling, the Lord was trying to tell me long time ago what was supposed to happen. I didn't listen. So now I had a little bit harder path, Tiffany. Now I got 2 kids, a dog, the husband, the whole household thing, and I'm working at the same time. That's how it was meant to happen. How it happens is literally how it's supposed to happen. That was my path. And so I went to Georgia State University, graduated, and ended up as a nurse extern right before graduation and worked in the burn ICU. And the rest is history. I worked the burn unit, loved that experience, loved those patients, um, and went on to get into quality and leadership from there. The rest is history. Went and was a trauma program manager after I was a burn program manager. Worked at another hospital where I was over their clinical quality for a 5 hospital system, and then found my way back to my birthplace in terms of as a nurse, baby nurse, and was back at the level 1 trauma center here in Atlanta, Grady Hospital. And that's where I moved up in the leadership realm, and the last position I held there was a vice president of the nursing professional development, which was where I really learned about the importance of leadership, burnout prevention, especially with the experiences that I saw and witnessed, and also what I experienced myself in terms of leadership's role in burnout and
Yeah.
how leaders can contribute to it, and how they can help avoid it and help
Wow.
staff to
Thank
cope.
you so much for sharing. Now, that's a powerful story. That's where we get to the triumph at the end, especially because a couple things you highlighted. Number one, and I hope my listeners are listening, it's never too late to make a change, right? Like, it's so funny. He said at age 22, he's like, oh, it's too late now. I'm about to graduate. It's too late for me to switch my career. Yet, you be maybe 22, 32, 42, 52, even 62 in your 60s. It's never too late,
Absolutely.
especially to follow passion. So I will say that. And, the doors
Mhm.
will open. Well, we know, God will open up the doors, the floodgates of heaven and rain down on us, especially when we're walking in our purpose. And so I just want to kind of highlight that. So thank you for highlighting
Absolutely.
those points for our listeners. You mentioned some things about burnout. And of course, we're going to get into it, which is next in our conversation. I kind of want to define it first so that the listeners can understand. People may not understand, like even to identify what they may be feeling at this present moment at their job. So, burnout is a work related stress syndrome resulting from chronic exposure to job stress, and healthcare workers are particularly at risk for burnout. I read an article pretty recently that discussed prevalence of and factors associated with nurse burnout in the United States of America. So, in this article, they state over 50,000 registered nurses surveyed that they who work over 20 hours per week. 31.5% of these nurses reported leaving their workplace because of burnout. So, of course, these findings suggest that burnout is a significant problem in the nursing field of both we both are in the nursing field. So, Dr. Day, in your experience, what are some common signs of burnout that nurses should be aware of?
Absolutely. Some of the advice that I give is if you are 3 days in a row dreading going into work, I'm not saying that you are burnt out, but you are at very high risk of burnt out. It's that emotional exhaustion. It's the exhaustion that can't be reconciled with just getting more sleep, right? Because it's a mental exhaustion. It's an emotional piece of fatigue that we have from not just the stressors of work for nurses and anyone that's in most almost everyone who's in healthcare faces this, that stress that just comes as a part of the job. We are dealing with high stakes consistently. Unless you're in, especially in the hospital setting, you're dealing with very serious issues. You're being asked to be in taking care of people in their most vulnerable moments, and the pressure of that is, I think it's still unmeasured. I think the weight of that responsibility is significant, and then when you pile on the fact that we still have this antiquated model of everyone working 12 hours, at a time in that hospital setting, and then what happens when you are overstaffed, when you don't have the resources, where, man, if there's something that we need to make sure it gets hardwired and we want to make sure that that process works, we need to give it to the nurse because that's the only person who we know is consistently there 24 hours a day. There's no one else. And the fact that the nurse is also in every care setting within the hospital. It doesn't matter if you're in the ambulatory setting, if you're in a procedural setting, you could be in the OR, you could be in the cath lab, or if, of course, in the inpatient setting, a nurse is there. That added stress and responsibility is it creeps up on you. You don't even feel it when it's happening. But those are some of the things to look out for. Just that mental exhaustion that is not relieved by rest, that dread of going into work where you are in a probably doing a job that you feel called to do. You feel passionate about it. But the fact that sometimes you could feel like, "Oh my, I cannot go in today. Like if I have to go, I'm so glad that I don't have to go." It's just like any job, of course. Of course, you enjoy your personal time and your free time. But when you're at a point where you're dreading it. I put a post on LinkedIn recently where there was a nurse sitting in the car and she was still in her first year and she was crying in the car and talking about how badly she wanted it, and I think that's what hurt her so much was how badly she wanted it, but how much she was dreading it. And a lot of that came from the environment that she was in. And I feel very strongly about the role that leaders play, not only in helping to support the staff, but not causing some of these issues, right? I'll give you the perfect example. It really struck me one day. My one up sent me an email and she sent it out to multiple leaders. There were some modules that had been assigned for well-being. We had contracted with a consultant, and they had these great modules. The content was wonderful, but we're looking at now another thing that the staff has to do, another thing that the leaders are responsible for making their staff do. And the wording of the email just struck me as just, what
Right.
are we doing? She was coming down on all of the leaders. I don't know what you guys are doing. I'm not sure what I have to do to get this compliance up for these wellness and resilience models. And it's like, did you read the words of the email? Like, and then we're needing to hold people accountable for completing the modules that are supposed to be something that is addressing their emotional exhaustion, their compassion fatigue, and their burnout symptoms and syndrome. And it's like,
Yeah.
what are we doing? What are we doing? Why are we not asking the staff, what is it that you need? I guarantee you they would not say more
100%. I
modules.
could not agree with you more. You brought up so many points that I would love to like dive in, but overall is as you were speaking, I was thinking, who are the faces of healthcare, right? Nurses. But who
Mhm,
carries the largest portion of the burden of healthcare? Nurses. Who are the largest
mhm.
people in healthcare as far as careers? Nurses. Right? And, yet we're the most we're almost the most tired people in healthcare. And moving forward, thank you so much for, sharing, highlighting a lot of good points regarding burnout and how to look out for the signs for it. So I hope for my note takers, I hope you were taking some notes. I want to move on a little bit, but still stay within that same realm, because there are also providers, right? Like, who, like for myself as a nurse practitioner, and I also sometimes feel burnout, not sometimes, a lot of times. So, my nurse practitioners or even physicians. So,
Mhm.
I read this article that I thought was brilliant. It was called I Had Fed Up. It's a qualitative study of Black nurse practitioners' experiences fighting against health equity, racism, and burnout. So I say triple fold, right, as an African American. And I feel like I could identify personally with this article. In it, the authors discuss a topic they phrased emotional exhaustion and minority tax. Have you heard of that? Yeah.
I have not. I know the emotional exhaustion, the exhaustion
Minority
part, but I
tax.
hadn't
So,
heard that other
what they
caveat.
discussed, the participants in this study, they reported physical and emotional exhaustion when advocating for equitable changes, particularly while being the only healthcare provider from a minoritized background. And also the burden to create this organizational change, right? It kind of falls on the only one that's there, right? Who's Black, right? So, coupled with increased workload, it often results, those two together, in this minority tax. So it's kind of defined as the burden of extra responsibilities, even placed, for instance, on minority faculty, plus, of course, clinicians in the name of diversity. So the emotional exhaustion and heightened by experiences of racism and microaggressions, because we can't forget about that, from colleagues and patients, creates this minority attack. I said minority attack. It's almost like a minority attack, but it's a minority tax. So, Dr. Day, what would you say regarding burnout, uniquely how it affects African American nurses, and what factors do you believe contribute to this experience?
I think there's a lot. I think the fact that there are still many of us who are that first person to graduate from college. There's a lot to uphold and a lot of expectations amongst our in our inner circle, our family who's very proud of us. I don't have my nurse practitioner, but I did get my doctorate, and I know that amongst in my family, I'm the only one with a doctorate degree, and so that definitely adds it's good. I am not I don't mean to paint a picture that that's not a good thing, but it does add some additional pressures. The other thing is the little things that you see every day when you're taking care of patients in these various healthcare models. And you feel like there's some things that are just so obvious. I'll tell you one that weighs on me. It still weighs on me. And this is coming from a hospital that 70 something percent of the patient population is African American, and the staff, the nursing staff, overwhelmingly African American amongst the nursing staff at this particular hospital. And it was amazing to me that I was looking at, again, because of the history with my grandmother, pressure injuries has always been something from a quality perspective that's near and dear to me in terms of wanting to avoid that pain for a patient. And it's amazing to me that we were still educating based on parameters that don't work for darker pigmented skin. Just something just that simple, right? I remember growing up and seeing and understanding that Band-Aids, before more recent history, were meant to be the color of someone else. And there was no thought that there was different skin color. Now that's not harmful, right? But it just is saying that you weren't thinking about me at all when you developed this. And so when we're teaching about pressure injury prevention, it's just one minor thing. Pressure injury prevention, we talk about blanching the skin. It almost takes until an African American patient, unless you're doing a very, very good tactile hands-on assessment, an African American patient almost has to get to a stage 2 where the skin is broken to some degree for it to really be noticed, or it's bruised, or it's a lighter pigmented skin, but darker pigmented skin. But we're sitting here as educators, the entire group, African American nurses and CNSs out there teaching, yeah, you need to press on the skin. Did it blanch? And it's like, did your skin blanch? you know, and we're doing these things every day. We know that the pulse oxes historically don't pick up our oxygenation levels the same. Did that lead to more deaths during COVID? Those things that we know because we're thinking about them. And I think that adds on, in addition to all of the social things that we know that African Americans deal with. On top of that, we also have this little piece that we know fundamentally gets down to differences in skin color. I think about a study. This was sitting in nursing school, and I was thinking about a research study that showed they were asking the question, oh, why is it that people of African descent who are from Africa, not descendants of slaves here in America, but from Africa, historically have not in the past, I think culturally some things are shifting, but in the past, 20, 25 years ago, did not suffer from blood pressure the same way that African Americans do. And they were so perplexed because it's like, they're all Black. And it's like, right. But the people, the descendants of the people who were able to survive slavery had a greater propensity probably to be able to hold on to water. That is what helped my ancestors in slavery survive that type of work, the type of working conditions that they had. And it was primarily because they did have an overwhelming. Those who couldn't probably were not the ones that were able to make it through after generation of 200 plus years of slavery. And so you think about those things, but it's just like we don't have enough people that are knowledgeable enough to have that information. We're kind of a second thought. It takes even these medicines that get researched, how do they impact us? We know that it's gonna impact us differently. We know that the pulse oximeters don't work the same. We know that the skin assessments that they teach us how to do it for pressure injury prevention is not the same. And we are usually on the losing end of that type of bias, and it's not intentional. It's not an accusation on anybody. It is what it is. But what's frustrating is when, as an African American healthcare provider, you speak up when you're not heard. That's when it gets to be
Absolutely.
frustrating.
And that all those things contribute to, I believe, what this article is referencing as the minority tax. Because, as an African American nurse practitioner in my institution where I work, I definitely feel as though I have to be the one to educate people. Regarding some of the systemic differences, because they don't understand. So there's that portion of ignorance. Then that's that portion where I have to give some explanation. Then I'm also experiencing it, the different inequities and even where I work. So that's a heavy weight,
Yeah,
to carry.
it really is. My very first poster presentation I ever did was on the burn unit, and it was the first time I ever was got accepted to present at a conference. Was for a patient. She was 9 years old and had sustained significant burns. I think I mentioned before that I was in the burn ICU. She had sustained significant scald burns, and it happened while she was getting her hair braided. This young lady came in and the mother was trying to explain to the resident, oh, we were doing her braids and we had the big cup and we were dipping her braids into this hot water and the steam hit her and she moved like that, knocked the cup out of my, and the water went all over her. They were prepared to call defects on the mom because they did not believe that
Yeah,
story. They're like, dipping braids. What is she talking about? And I stepped in. I was like, this is a thing.
absolutely.
This is a whole thing. And he just was not, I mean, as soon as it got explained, he understood. But I'm like, this is why it's so important to have representation from all sorts of cultures and backgrounds. But that is an extra stress on that nurse to be the one who I feel like I'm representing the culture by making sure that you don't call defects on this mom because this is a real thing. Now were all the safety measures taken maybe that mom could have done some things differently to avoid the scald burn? Sure. But there was no intent. There was should not have been any cause to defects, which thank goodness it did not happen. But I was so bothered and disturbed by that. I wanted to do a poster presentation and then did some community service out at like beauty shops and daycare centers where we were I handed out flyers to just make parents aware of the risks of not using, a big cup with a handle on it, not just holding the big cup with your hands because it can slip. So little things like that. If not having someone there who could advocate and do that, now we've got some prevention opportunities that may not be able to be implemented because there's not someone there who can speak for that. But I felt a responsibility for that young lady, for her mother who was already traumatized and probably feeling all sorts of guilt over what had happened to her little girl. And so, yes, there definitely is, and I still think we're still so underrepresented. Again, that same conference that I went to was the first time I really realized. I mean, I was in a bubble. Born and raised in Atlanta, growing up as a baby nurse at Grady Hospital, I did not realize what it was like until I went to a conference, and I was like, okay. I think in this particular session, I might be the only. No, there's another one. Yeah. Hey, girl. Um, um, that you don't realize it. And so it's almost like you have really need to go overboard in order to make sure that that's represented. But it does add, it's that hidden stress that you have in any industry where you're underrepresented, but in particularly in healthcare, there's an extra element and caveat to it because so much of decisions that get made, so much of culture, so much of pain tolerance, those type of things that are preconceived myths that need to be dispelled, but you have to have the right people there to be able to do that. And so I take pride in that, but there is also definitely a burden because you do
Mhm,
feel like
mhm.
there's a
100%. I
responsibility.
couldn't agree more. This book TD Jakes wrote years ago, maybe 20, 30 years ago. He's, for those who don't know who TD Jakes is, he's a bishop, a pastor at a church in Texas. But he's also an author and et cetera, et cetera. But I'm not here to promote him. I just thought about a book though that as you were talking, it was called Can You Stand to Be Blessed? And that book from like 20, 30 years, I think I read it 20, 30 years ago, but he talks about the weight of a blessing.
You read that book when you were 5 years old?
Hey,
You
20, 30 years,
advanced, Miss
about no, more
Tiffany.
like 20 years ago, not 30. 30, I was about 17. But yeah, probably about 20 years ago. I read it pretty early in my nursing career, about, and it kind of helped me, as far as understanding number one, what it means to be blessed, and going through different scriptures and stuff like that to understand what each blessing means and what the weight that you have to go with the blessing, right? So I would say, in the sense of this career, I'm glad that you were there. I'm glad that you were in that space where you can make such a great difference and make a change, right? Educationally. But the blessing in that is there's the minority tax, right? so so I want to talk a little bit more about, burnout and coaching as far as yourself. And, so what experiences have you had with burnout and impacting your career? And how do you feel that made you shift to career coaching in a sense?
I won't say that I wish I had done differently because I'm on the path that I'm supposed to be on, but there are people who have the opportunity to do something differently before when you start to see those signs of burnout. Chances are you've tolerated and put up with behavior from others, whether that's peers or your one up. In my case, it was definitely my one up. There were behaviors that I tolerated, and I actually took accountability and ownership of her behaviors. I'll put it like that. That clearly this person is in this position. They've got to be, they're experienced. They've got to be, there's so much. I'm always open to thinking that I have things to learn from my leader. And I did, but not in the way that I thought. It was more of learning what not to do. And so those experiences really taught me how to be a better leader. It taught me just how to be a better nurse, to have more compassion, to be authentic. And so what I found was that there was so much belief, knowledge. And this is what I kept thinking at first. I'm giving a lot of benefit of the doubt. Maybe this person doesn't know any better. Maybe this person doesn't realize what they're doing. Those were just excuses. I knew the whole time, but I was new in my role as an executive. This person was new in her role as well as an officer. And so I felt like we were all learning at first. Then it turned into something else. And where I feel like I could have done something differently is really how I want to coach other nurses, nurses who start to feel those and recognize it. I did not recognize what was happening until it was too late. And then Southeast Atlanta came out of Dania. I maintain my professionalism. Anybody who knows me knows I will maintain professionalism. But there were some choices that I made, and I had a very strongly worded email that I sent out that I was speaking truth to power. And I knew in the moment I was speaking truth to power. I also knew that the person I was speaking to was not emotionally prepared to receive the mirror that I was
Mm.
holding up to her. She wasn't ready for that, but I was ready to hold up the mirror. And my one thing that I could have done differently was to prepare myself a little bit better for the consequences of what I chose to do. I own it. I would do it again. 100%. I would do it the exact same way over again, except that maybe I think I would have had
Got it.
my exit strategy. I just came off the expressway. It went on a ramp. It was It was rocky, and I was I listen, but I got off of it because it was either that or crash and burn because that's where it was headed. And oh my gosh, it was so many lessons learned. You learned so many lessons from that. But the one thing that I would say and what I try to coach on is this is your career, it's your license, it's your degree. You've done the work. No leader has done that for you. You don't owe anybody anything. I think the fact that registered nurses are rolled into the universal room charge leads us to an unconscious belief that the hospital
Mm.
owns us in a way, not only owns our practice, but as if they also own our power, as if they own our ability for resilience. I overheard a nurse recently who made the comment, these hospitals have to do a better job of giving us resilience training. And it's like they're only going to give you what they want to give you. And if you need, if you're that at that point where you are looking for someone to train you on how to be resilient, it's probably time to get out of that space. If we're going to rely on, it's almost like I was thinking about this earlier. My analogy is someone comes in your room, your house, and they mess your house all up. They mess it up. They tear up the furniture. They're ripping up pillows. Everything is in complete discombobulation. And then they sit there and then they tell you how much of a mess your house is, and that but I have something for you to help you with that. If you like, I can help you, and I'm the only person that can give this to you. I'm gonna help
Yeah.
you get
Mhm.
this house clean. Isn't that great of me? And it's like, you were the one who did this. So it's the same thing. Hospital systems and many leaders, I'm not saying every leader, but many leaders at the highest level are the ones who are inflicting some of these things onto the staff and then want to come and throw you the lifeline when they're the ones that threw you
You
over the
better
boat in the
preach.
first place. I don't even think that a lot of times that they see the hypocrisy. I don't think that they get it. I know that the frontline staff knows it, but in that moment it never hit me any harder than when I was got that email and it was just like, what are you guys doing to get the compliance up for these wellness modules? I was like, this is I laughed. I laughed. I was like, what are we doing? What are we doing? We're inflicting these things on people and then we want to come back and act like we're going to be the heroes and save the day and give them all these wonderful tools that really is just more work
We're not gonna get on
at the end of the
awards
day.
and boba and
So
celebrations and, all these things to, I
rolling around the little red wagon with little, little Halloween candy in it. It's just like these folks are making 60, 70, $80 an hour. They do not need these old cookies from little Debbie's that are 6 months old from outside of this wagon. We need to
exactly.
give them what it is that they want. And so that is what really, once I got out of that space and I had the room to think, what do I want to do? I had the opportunity to no longer transact
Yeah,
in that hypocrisy. I was now free to be able to come and say, how do I want to be able to help frontline staff, nurses that are coming into this industry who they're very proud and excited about what they're doing. I've seen so many videos on Instagram and TikTok with people seeing their NCLEX scores and being excited, and it's wonderful. How can I help protect that? I would see new nurses coming in, and one nurse in particular that really struck me. I knew her when she was a nursing student, helped her kind of get through and navigate NCLEX and help give her some support that she needed. She was brilliant. She was a wonderful nursing student. She got her dream job. She wanted to be in the ED, but she had no guidance. She just knew that's where she wanted to be. I think one too many episodes of Grey's Anatomy. She wanted to be in the ED, honey. It wasn't no talking her out of it. But she fast forward about 3, 4 months, she had been in the ED and I saw her. She had dropped 10, 15 pounds. She looked awful. That little spark and that shine she had was gone. And I asked her, what's going on? What's happening with you? And she just burst out crying. And what it was, she said that I think I made a mistake. I'm going to finish out this residency, but I think I'm getting out of nursing. And I knew it deep in my heart, this is a nurse. This young lady is a nurse. She had followed her purpose, but we were not good stewards of her passion. right? We did not respect her passion and her purpose. That was the first time I was like, I got to do something different because I feel like I'm the vice president of nursing professional development. I have strategic oversight for the residents, for the nurse externs, for every single nurse that has orientation, they come through my department. And to have someone with such a bright future say to me that she thought that nursing wasn't for her. So I spent a lot of time with her, working with her, talking her through it. She was in the wrong place. She was in not in that hospital, but she was just in the wrong department. And so when I left, I first thing I wanted to do, well, I did have a moment, Tiffany, where I wanted to write my confessions of a nurse leader and spill all the tea about everything. I was getting ready. Oh, I was about to go in. And I said, you know what? I don't want my first book to be the base and the foundation of it to be with so much negativity. I still need to process all of that, what happened. But what I did know I wanted to do is continue to help nurses who either were new to nursing or who were ready to pivot and do something different with their career. And so I'm so excited. I've completed the draft of my manuscript for the book that you mentioned earlier, Find Your Fit. It's Find Your Fit, a nurse's guide to choosing the right unit. And there's all kinds of advice. It's about the unit. There's a little bit in there about choosing the right hospital because every hospital there's hospitals have a personality, just like the units do. And so finding that right fit too for yourself as a nurse, it's so important, especially in those first couple of years, whether it's the first couple of years new to nursing or first couple of years when you are experienced and trying something different. And so that is now my passion. I love to talk about it. I cannot wait for my book to come out. I'm going to be
Yeah.
sharing it with people. I need y'all's help picking out the cover. I got different designs. I need to narrow this down. So look out for more information. It is coming, but our goal is to get this
Well, I'm
book
so
launched
excited for the book
this
and
fall.
how you use pain again for purpose, right? And especially seeing this other young lady that you said worked in the emergency department and not only just seeing the pain that she was in, recognizing it, because as nurses, we can do assessments even of our friends and family and other people. So you saw her, that she lost weight and you inquired about what was going on and then you helped her to shift. So I wanted to ask, a few more questions before we conclude, particularly regarding nurse transition before nursing career transitions before your book comes out. So what, can we leave with our audience? What are some key steps nurses can take who are considering a transition, maybe due to burnout or just want to try something different? What would be the next step would you recommend for a nurse who is in that position?
I think the first step is to do a personal inventory. And so I have it's something I have created called the pivot plan. And I have a couple of few clients that I'm working with one on one right now as I'm kind of doing them as like almost like beta testing, one on one to get some good idea of what is the person who is experienced, the experienced leader, the experienced nurse. What are you looking for? So we start off with an assessment of what's working now? What do you, if you could wave a magic wand, what would you change about your current situation? And the wonderful thing about nursing is there is so much you could find it, whatever your passion is. If you want to start your own business, if you're wanting to be much more on the clinical side, if you want to be in the school setting, if you want to be, I mean, if you want to be, the most fabulous med spa owner on the planet. There are so many avenues that I just don't think there's any reason to get out of nursing altogether. It's more about sitting back. How can I utilize all this knowledge that I've gained over all these years? How can I tap into that while at the same time what was working for me maybe 10 years ago is just not where I am anymore. That's the case, and we need to figure out how do we make that pivot. So it really is doing kind of an inventory of yourself, seeing what all those options are, and there are a lot, doing some research. And I am huge. My quality and data-driven mind, I love to use data. And so I think a lot of it has to do with what gives you that energy. So I focus on the three E's, which is your energy, your enjoyment, and what makes you feel energetic. And when at the end of the day and you say that was an excellent day. So what makes you feel that inner excellence, the enjoyment, and what gives you energy at the end of the day? Even if that day was tough and hard and it was a lot of work and it was a long day, but you still feel energized, then you're in that right space. This is where you want to be, but we just got to figure out where that is. And so I like to work and try and clear away the cobwebs, clear away all what I feel like what really gets that experienced nurse is the naysayers. And unfortunately, because we are sponges as nurses, we naturally like to collaborate. We like to get opinions. We like to talk through things. We can be misguided, and not by anybody intentionally, but other people. You could be deterred by someone else's fear of failure, and it can spread. It's toxic. It's toxic, that fear. And it's like, that's okay for them. If they're not ready and they don't want to take that risk and that chance to do something different, I haven't had a single person who's gone through this journey who did not come out on the other end saying that was the right decision. I've never spoken with someone who said, dang, I sure wish I could go back to that space I was in where I was frustrated every day and I was burnt out and I was just leave me alone. And I just lived for holidays and vacations because my day to day existence was so unfulfilling. um, I've not talked to a single person who's made these type of transitions and they weren't better off on the other side. Um, and I think part of it is that it really is taking an assessment and seeing what is it that I want, not just what I'm going to get through. You don't have to be that nurse that says, I want to be that nurse who's at the employee reception and I'm getting honored for being a nurse at the same hospital for 35 years. If that's your goal, so be it. But if it's not, that's not, if that at the end of the day is not your goal, take that chance, take that risk. You are betting on yourself. You will never fail when you do that because you know you're going to look out for
Wow.
you more than
Well,
anybody
Dr.
else.
Danny, you have said quite a bit. I hear a lot of hints of like multiple things, right? You're talking about mentorship. So, with being a coach, in nursing, you're also a mentor, right? Then also I'm hearing too, like there are nurses who may be out there and not sure what steps you need to consider to take, when you're facing career burnout or not sure, what you may feel stuck in your current role, and unsure about what making the changes. So you need to take that assessment. Yeah, so I think that's good.
Absolutely, and know that there's a lot of coaches out here. It's almost like finding a friend or a therapist. That's not the role. What I mean by that, though, is that there is someone who's gonna vibe and mix with someone else differently. So, I would say that too, like, to look around, shop around, see who's got that same energy you're looking for that you vibe with. Not someone who's gonna let you get away with saying whatever you wanna say. You still want somebody that's gonna challenge you and push you to get out of that comfort zone because it can be a little off-putting, right? It's especially as a nurse. You've got that routine down pat. You've been doing this thing for 10 years. I know exactly what to do. I know to park from the time I know what parking space I'm a park in every day so that I can get out as quickly as possible when it's time to go home. From that to knowing how to do your rounds at the end and you're doing your documentation and you're signing off for the day. As comfortable as you are with that, be prepared to be okay with being uncomfortable. That's one thing that I will say because it will be. You might feel energized and everything, but it's still gonna feel like, what am I doing? I can't believe I'm doing this. 'Cause when I sat down to write a book, my mama was like, I thought only famous people write books.
Well, she's speaking it out into existence because that's the part to be famous.
Hey, look. There you go, there you go, but it doesn't matter if 5 people get my book, if 6 I you have something
Mhm.
to say, just say it. You never know who you're touching, you may never ever know that you had an impact on somebody else just from sharing your story. So if that story's in a book or if that story is just the example that you set because you say, "I'm not gonna show up to a place every day where I feel like I've hit a ceiling." And that's okay. It's okay. I hit a ceiling and there's something else I want to do and I want to
All
explore and
right.
stretch my wings.
Well, you have given us so many pearls. Usually I like to conclude my podcast and ask my, guests, to give me one pearl of wisdom you want to share with nurses. However, you've given so many. I hope my note takers are taking notes. But I would like to ask you, is there anything else, one last tidbit maybe that you haven't mentioned that you want to share with the listeners, particularly about how to connect with you I know we know about your book, but please now's the time if you want to share any last words with our listeners today.
Follow me. It's Dr. Day, the nurse coach. I'm on LinkedIn. You'll find me with my name on LinkedIn because I still keep that connected. I had way too many connections So it's Dayna Scott Vidal that you can find me on LinkedIn. And then on Instagram, TikTok, YouTube, I am Dr. Day, the recovering nurse executive. That is my tagline. And that's another thing. You come up with something, go get it trademarked. So for all y'all entrepreneurs, don't think yeah, you got to do it. Put your stamp on there. You just never know. It's better safe than sorry. But yes, follow me. I try to be as authentic and real as possible. I've had so many experiences across multiple different types of hospitals in multiple different settings. And then the background, I've pivoted. That's why I called my program for experienced nurses who are looking to do something different, call it the pivot plan. I pivoted out of business and marketing into nursing. I pivoted from being at the bedside and pivoted into leadership, pivoted into quality, worked at multiple hospitals. And now I'm taking this next step of pivoting into entrepreneurship and being an author.
I love
Who
it.
knew?
I love it.
Who knew? So just
Mhm.
take that leap. Don't be afraid. The bedside will always be there. If you get out there and you're like, oh, I don't like the way this water feels, the temperature's not right. It will be there, but you will not have that regret of saying, dang, I wonder if I had
Mhm.
done X, Y, and Z, or if I had tried to. You just never know. Sky's the limit. Nurses are amazing, which means we can do amazing
Wow,
things. So
wow.
don't ever limit
Thank you
yourself.
so much. Well, folks, this concludes another episode of You Belong in Here. I hate to end because we're learning so much and I'm receiving so much from this beautiful, smart, intelligent Dr. Day. So thank you so much, Dr. Day, for being an amazing guest and sharing your inspirational and transformational pivoted journey and pearls of wisdom.
Tiffany, thank you so much for inviting me. This has been not just just inspirational. I know your story as well. You are a motivator. You inspire me. And again, like I told you before, you were talking about Jake's, but you got me on Daniel's, so I'm all about it. And that's another thing, right? You shared that with me, but I want to thank you so much. You are a motivator and you're out here doing things. And I thank you so much for allowing me to share my
Course.
story and giving
And
me
thank
this
you,
space.
listeners, for tuning in again. And we hope, as usual, this episode encourages you, motivates you, and know that your presence is necessary in your space, whether it's the workplace or whether it's schooling. So, of course, share this episode with others. It's available on YouTube, Spotify, and Apple Podcasts. So, tune in 2 weeks for the next episode of You Belong in Here, where we will continue to explore topics in equity in healthcare and equity in the workplace. Thank you all again and keep pushing forward.